nearly 24 million people in the United States have diabetes, and medical experts are most concerned because type 2 diabetes is on the rise. It's now estimated 1 in 10 have type 2 diabetes. There is help for people who suffer from this disease, and Dr. Jonathan Spages from Integrated Health Center of New Jersey, well, he works with diabetic patients every day. He's with me now to discuss treatment, lifestyle options, and how you can reclaim your health today. Welcome, doctor.
Thank you, Grace.
Nice to see you. So why does diabetes continue to be so frustrating? It's a huge topic.
Yeah, it really is. It's frustrating for a few reasons. One is on a pretty routine basis, diabetics are showing up to medical doctor's office not really having a lot of answers. Maybe even on a routine blood work, they see that they have high glucose levels and high A1C. The doctor then says a few things. One is change your lifestyle, lose some weight, and then here's a medication. And what happens at that point is one medication triggers another medication, which triggers sometimes even another medication. Eventually, the conversation of, hey, you have to go on insulin shows up, and that's when insulin perpetuates the disease and they get worse. And the frustration happens is that these diabetic patients are doing things. They're doing things in their life that should be making changes. They're changing their diet, they're even exercising, and they're still just not getting results. They're getting worse over time, not better. And rightfully so, they're frustrated, and they lose help, and they also lose hope. They think there's nothing else possible out there. But there is help, and there is hope.
Doctor, can you talk to me a little bit about the fact that there is so much misinformation out there, even just doing the research for the show today to sit down and speak with you?
Yeah.
You pull up one website, it says this. You pull up another website, it says that. Can you talk to me about that? Sure.
The problem you're seeing is that diabetics are trying to figure out what exactly is wrong. And there is a lot of information out there. There's a lot of therapies, there's a lot of things out there that say that it could affect blood sugar levels. But what I'm finding out is that there is not actually one reason why a person is a diabetic. It is unique to each individual. And I kind of wipe away the whole label of being a diabetic, and I look individually, patient by patient, to find out actually what their root reason is and why they're having blood sugar problems. And what's occurring is they think that just it's one thing. If I just take this particular supplement, or if I just eat nothing but celery for a whole day, that's going to be the solution to the problem. And it isn't. It's unique to each individual. And what's occurring is that they're trying to self-diagnose themselves, and that's where the real beauty of getting a proper, comprehensive diagnosis and really looking at the individual really makes a big change in their life.
Can you talk to me a little bit about the testing that you do with your patients?
Absolutely. First off, the testing is very comprehensive. It's really detective work, finding the root reason why they've become a diabetic in the first place. So I'm looking not necessarily only at the pancreas. I mean, the pancreas tends to be, in most cases, not the problem. It's other areas of the body that need to be addressed, and those areas just aren't looked at in the medical model. The standard of care currently is not allowing a patient to really find out the real cause of why they become a diabetic.
If a person is diabetic and you don't get the proper kinds of treatment, what sort of life are they facing?
Well, their life is destroyed pretty much for a lot of reasons. One is that there's consequences to having this disease: blindness, amputation, kidney failure, even heart problems. That's alarming, but really what it costs a diabetic is everything else. Not having energy level through the day affects their ability to enjoy their friends and family. Not being able to control their weight affects other things in life, sometimes even traveling as a result of gaining excess weight. And really just being able to sleep at night knowing that the following day you could have a real serious complication is alarming enough. So I take this disease very seriously, and really there is something that you can do. The results we're getting with our patients is that patients are losing weight effortlessly. We're seeing that they're getting off their medication. We see that their life can get back and they could be the best them, and it's just incredible. Especially the energy level you see on some of these patients is just amazing. So it's a lot of fun seeing these people and seeing them do well.
So you're changing people's lives in your practice.
Yeah.
Yeah. Doctor, thank you so much.
Thank you very much.
Appreciate it.